Wouldn't it be cool to look at electrical wavelengths and know exactly what's happening in somebody's body, more specifically their heart? I can do that. I'm a monitor tech at Carolina's Healthcare System Cleveland, and I have been for about 3 years. It's a learning process, and I learn something new every day. Today I'm going to be talking about the process to becoming a monitor tech, what monitor techs need to learn, and why they're necessary to the healthcare field. To become a monitor tech, you can either simply apply for a job at a hospital or on a cardiac unit and be trained on the job to learn everything that you need to know, or you could go to a community college for a few classes on echocardiograms and learn how to run those echocardiogram machines and learn the cardiac rhythms. You can ask questions daily on your job as a monitor tech to cardiologists and nurses. It makes it more beneficial to you and your knowledge of your job in order to ask these questions so that you know how to treat your patients. And personally, what I found that has helped me the most is research and studying on my own. If I find something that's confusing or I don't quite understand what the cardiologist or the nurse is saying, I can Google something and I can do my own research even while I'm at home. I don't have to be at work to learn something new about a heart rhythm. To read heart rhythms, which is what you need to learn to be a monitor tech, there is probably 16 different heart rhythms that we should know, but I'm just going to cover a few basic ones. The normal one that you should be in at all times is called the normal sinus rhythm, and there are 3 little waves that come with it: a P wave, a QRS complex, and a T wave, which if you ever see a heart rate anywhere is the 3 blips that you see. The P wave, which is the very beginning, happens when the top part of the heart contracts. The QRS complex happens when the top part relaxes and the bottom part contracts. And then the T wave happens when the bottom part of your heart relaxes. And this is the process of making blood flow through your body. And a normal heart rate is between 60 and 100 beats a minute. If it's below 60, it's considered bradycardic or slow. And if it's above 100, it's tachycardic or fast. Atrial fib, or atrial fibrillation, is another common heart rhythm that you have to take blood thinners for because it can cause blood clots and strokes if not taken care of properly. It makes your heart rate very irregular and your blood doesn't pump through your body the way that it's supposed to. Atrial flutter is a form or a variant of AFib, but it is more regular. And it's just got extra waves all through it that you can see, and it kind of looks like the teeth of a saw. Some deadly rhythms that you probably hear on shows such as Grey's Anatomy are ventricular fibrillation, or VFib, and torsades, which is a variant of VFib, and these are rhythms that we would shock in order to get them back normal. Or you might see on some of these shows somebody punching someone in the chest, which is more frowned upon now than what it used to be. That used to be the theory to correct the heart rhythm. Also, if you see a flat line, we call that asystole, which basically means there is no electrical activity in the heart, otherwise known as death. You would not shock this rhythm. You would begin compressions and go through the process of CPR in order to get their blood flowing to make sure that they don't go brain dead before you are able to retrieve their heart rate again. Monitor techs are necessary because we are able to watch the heart rhythm and the rate for 24 hours a day, 7 days a week, around the clock. It's needed because we can see intricacies and changes in the heart in real time. That way it doesn't shock the doctor or the nurse when they see it later on. It helps the doctors and the nurses know how to treat their patients with different medications, how to adjust their medications, and what lifestyle the patient should live from this day forward. In review, I'm a monitor tech. I have been for 3 years. I still learn something new every single day. I ask questions and I do studying on my own. Rhythms are tricky and they're intricate and they're all unique, but they're not impossible after a few weeks of training on the job. Monitor techs are necessary because we literally save lives. Thank you.